Hello, today we're going to do the fourth part of our Premier Pediatrics Infant Sleep series. We should be joined by Pam Brower from Save a Tot in just a moment or two, so if you just hold on, we'll wait for her. And she's going to talk about infant CPR. So just give us a couple of minutes. While we're waiting for her, I'd just like to tell everyone about the program that's sponsoring this, which is our first month program. It's called the First Month, and it's a program that's been created to help parents transition from pregnancy to parenthood. And we have a lot of breastfeeding support, including breastfeeding that's a part of our actual well care. We also have social workers who come to the office, or now they do it by Zoom, to help parents with just their own emotional transition to parenthood. Then the third part is we have different lecture series, which have now been moved on to Instagram. And the sleep series is a part of that. Let me see where she is, if she's on. And while we're waiting, if anybody has any other sleep questions I can help you with, I'm happy to answer them. Let me see where Oh, there we go. Just give us one moment. Hey, Pam.
Hi there.
How are you doing?
I'm good. How are you doing?
I'm doing quite well. So nice to see you.
Likewise.
Whoop, I think we got to turn it back. I think you're off on the...
Let's see. I'm trying to, let's see. Trying to fix this so we can see it looks like it's dark where I am.
No, you look okay. We just can't see the mannequin.
The baby.
Oh, there we go.
Yeah, I put up on some books here.
That'll do it.
Let's see. No, let's see.
I think you're okay. I think that height will do it.
They can see the side to talk to me, so this is good?
Yeah, I think that's good. I think you're great.
All right.
Well, anyway, I'm joined by Pam Brower. She's a friend to our practice and the founder of Save a Tot. And she was going to go over infant CPR and infant choking. We figured while we're talking about sleep, it's always nice when you're not in the room with your child to feel comfortable that you have all the skills you need, just in a very, very rare case that you needed to use them. And also there's some peace of mind in knowing those skills as well. So I'm going to let Pam, again, if you have any questions about any of this stuff, Pam's accessible through saveatot.com, is it? Or
saveatot@gmail.com.
saveatot@gmail.com. And we're really fortunate. She's tremendous. And I'm going to just hand it over to you, Pam, and let you do your thing.
Great, thank you. So hello, everybody. Hope everybody's doing well. So in CPR, there are 3 age groups. So infant goes birth to 1 year old. Child goes from 1 to 12 years. And anybody over 12 is considered an adult. So we're going to focus on the baby, birth to 1. So sometimes this class can cause anxieties. That's normal, but knowledge is power. Mm-hmm. So this is my baby, Jessica. She's sleeping. She hasn't woken up from her nap. So I go in and I check on my baby. So we know that the heart is located on the left side. Boom, boom, boom. Sometimes the heart...
I think we have to go a little higher. Just a
little bit higher, like up here.
That's perfect, yeah. Any other books?
Let me see what we can do. Hold on one. Oh, yeah. Hold on a second. Let me get somebody to get me a book.
Okay, take your time.
Sorry, everybody.
While you're doing that, okay, there you go. Perfect.
Okay, I'm just going to hold it and somebody will come grab me a book or something. Perfect. So anyway, the heart, boom, boom, boom. Sometimes the heart doesn't work properly and sometimes it could stop altogether. Now, most babies, wait, hold on. Can you grab me a book, something for help? Thanks. Okay, we're getting another book. So anyway, sometimes the heart doesn't work properly and sometimes it could stop altogether. So most parents want to know, why would something like this happen to a baby? So the number one reason is accidents. So we try to do the best we can to prevent them, but we're not perfect. Things happen. So then we just have to know what to do about it when it does. Second is very high in this country, and that is drowning. And then number 3 is illness. So if the heart is not pumping right, it's not going to send enough good oxygen to your vital organs. Brain, heart, lungs, and kidneys. If they become hot, can you just grab me a book, a box? The box. Okay. If they become poorly perfused, we turn the color blue. So I go in and I see my baby blue. Would I panic? Of course. So let's see if this works. How's that?
Perfect.
Okay. So I see my baby blue. Would I panic? Of course. So the first thing we're going to do is try to wake up your baby. So you're going to pick up a leg, either leg, doesn't matter. And at the bottom of the foot is where your baby's reflex is the strongest up to about their first birthday. And then you're going to bang the foot, and then you're going to call their name. Jessica, Jessica, wake up for mommy. Wake up, wake up. Now, if your baby responds, excellent. If you're not alone, have somebody call 911. Otherwise, grab your phone and make the call. So this is not call your pediatrician. This is not go to the emergency room. This is a true 911 call. But there's nothing to do because your baby did respond. Now, the next one is we did the same thing, except this time the baby doesn't respond. So now I'm going to look at the chest for any kind of breathing. It's not always easy to see on a little baby, and especially if they have a sleep sack or a jacket. Put your hand across, and that's going to tell you if the baby is breathing or not. So now you see your baby is not breathing. Someone's in the home, yell out loud for them to call 911. If you're by yourself, you must perform 5 cycles of CPR. Then you go to the phone, and that's to call 911. And that's from birth to 12 years old. Over 12 years old, you always call first, then start. So for kids, we have to start first. And that's because children suffer from what's called respiratory arrests. So the quicker you get that oxygen going, better chance children have going forward. So now, I'm by myself. My baby's in her crib. Can't do CPR in the crib. First of all, I can't reach. But the main reason is the baby's on a mattress. Too soft. So you're going to scoop up your baby, and you're going to put them on the floor. No area rugs, tummy mats, foams, and all those things that we all have around. Always on the ground. If you're out and about, grass, gravel, concrete, sand, that's exactly where you're going to put your baby. Life and death always comes first. Now, what happens if you only have carpet? Look for a book, a photo album, how about a box? And then you're going to just put the baby right on top of that, and then that is the hard surface. Now, CPR is made up of the word CAB, C-A-B. So C stands for close, chest, compressions, A, airway, B, breath. So first, close. Can't do CPR with clothes on. We have to be able to see the chest to know where we're going, and we have to have skin to skin. So you're just going to take their outfit here, and you're just going to slip it over. The only time you would not do that is if the child fell or there was some type of an accident, just in case there's an injury or to the back of the spine or the neck area. So then you would just roll the shirt right up to here. Diaper, what have you, all stays put. So now we see the chest. Skip that for just a second and go to compressions. So when we compress for a baby, we use fingers. So they're going to be, these 2 fingers usually are your strongest. You're going to use the pads of your fingers, not the tips. So this would be the pads. If you go up too high like that, that's too high. You can hurt your own fingers and you won't get enough bounce. So 2 fingers here in the center of the chest. Now, we don't always have enough oomph in these 2 fingers, more so with women than men. So if that's the case, just take 2 fingers from your other hand and put them on top of those 2, and then you're good to go.
Pam, when you're describing the center of the chest, are there landmarks that can help people identify where they should do it?
Yes, that's what I'm going to talk about next.
Oh, I'm sorry. Sorry, yeah.
That's okay. So that's compressions if you're going to use 2 fingers. So now go back to chest. And where do you put your fingers? So you're going to make an imaginary line between the nipple and the nipple, and you're going to put your finger right smack in the middle. Then you're going to drop it just a hair, put your other finger next to it in the center. So we don't want to go to the left, we don't want to go to the right, and that's because that's where all your ribs are, so we want to try to stay away from there. And you're also working off the diaphragm, which is like a letter C here, and then you're bouncing right off of that diaphragm, which in turn is pumping the chest. So now, the one thing is you're going to stay in the middle, and the one way to never make an error is it's equal to your belly button. So here's your belly button straight up, and your chin, so not left, not right, in the center. So now, that's where your fingers go. So now, compressions. You're going to compress 30 times at a rate of 100 to 120 beats per minute, equal to the depth of 1.5 inches. So it's a lot of numbers that, don't worry, you don't have to remember. I'm going to make it easier for you in a minute. So first I'm going to show you what it looks like, and then we'll take that apart. So it looks like this. 1, oh, it's on the box a little hard here. 2, 3, 4, 5, 6, 30 times. So now speed. Nobody's going to know how fast or slow you're going on a kitchen floor. So what do we want you to remember is to push fast. So it's almost like a dance rhythm. A 1, 2, 3, 4, 5, 6, 7, 8. Everybody can kind of get that beat to beat down pat. For men, actually, a lot of men tend to push too fast, and that's because they just have stronger power in their arms. So if you're going 1, 2, 3, 4, 5, really quick like that, it's not going to pump the heart. It's just going to like fibrillate it. So you want to make sure, like when you play piano, you always see that up and down motion. That's what you want to be able to see. So that's your speed. The depth, 1.5 inches. That's the hardest part. 1.5 inches is pretty deep. You have to really be able to get down there. So if I was in a home class with you now, most people would just be about 1/4 of an inch, and it would be like, okay, 28, 29, 30, we're good. No way. So when you're doing this, your fingers should hurt, your hands can cramp up. A lot of people say, oh no, I cannot push that deep on my little baby. I understand that too. It looks a lot scary. It is scary, but you want to try to look past those fears and look at the bigger picture is you have to save your baby. You have to get that heart to pump. Anything that you can do, from doing it too hard, from doing it to the left or to the right, we can fix all of that later. Now the most important thing is to get that heart to pump. So you want to get all the way down deep, 1.5 inches, and count to 30. So that's your letter C of the CAM. Close off. Chest is where you put your fingers in the center, in between the nipple line, a little bit below, and then compressions, 30, fast and deep. So now comes the next letter, letter A, airway. So you're going to take your non-dominant hand, put it on the baby's forehead, as if you're checking if the baby had a fever, and then you're going to bring the baby's head back like it's looking up at the sky. Now, you know little babies' heads are not going to stay that way. They're always going to fall down. So how do we keep it back? Take the 2 fingers of your right hand, or if, vice versa if you're lefty, with your thumb and your index finger, and you're going to stabilize the jawline, almost like you don't want your baby to move. And this will prevent this rocking, because if the head falls down, the oxygen is not going to get through, so that's not going to be good. So you want to make sure you keep that airway always open. Then you're going to take your pinky here, rest it anywhere it's comfortable for you on the chest. That's so the next letter, B, breath, you're going to be able to feel your breath rise, your chest rise and fall from your own breath. So this way you're going to know that you're doing it correctly. So that's your letter A, airway. Letter B, breath. Because the baby's face is tiny and because their nose is not pinchable yet, you're going to take your mouth, cover your baby's nostrils and mouth with your mouth. You're going to make a tight seal, almost like you're going to blow bubbles through a straw. You got to seal that up to see the bubbles. So make sure you seal this whole area. And then you're going to give 2 small puffs. Just enough to feel that chest rise and fall. It's not like how much can I get in, how much air can we blow in. Babies' lungs are very tiny, okay, like this big. They don't need a lot of oxygen from you, a bigger breath. So you want to make sure 2 small puffs. So it looks like such. A little hard to do here with the box. Hold on a second. We've got a problem with the mannequin now. Okay, that should be good. There, you should be able to see that. So 2 puffs. So what you just learned is called a cycle. 30 pumps, head back, puff, puff. That's 1. How many cycles we're going to do? 5. That's approximately 2 minutes. After you completed the 5th cycle, you're going to evaluate your work. So whoever found the child is the one that should evaluate. So you're looking at 3 things: color, movement, breathing. So does my baby look the same, worse, better? Maybe your answer is just, I don't know. That's okay. What about movement? If you see any kind of kicking, that doesn't count as movement because that could be that reflex that we talked about. So anything from the waist up is a good thing. And then, is my baby breathing? So after you've done that, if somebody was in the home with you, they're on the phone calling 911, you can switch with that person at this time, not before the 2 minutes. If you're fine at continuing, feed the information to that person so they can tell the operator, and then you're going to continue on 32 puffs and keep on going. But what happens if you're by yourself? You can't stay alone. So you're going to leave the baby on the ground, go open up your door. This way, when medical professionals arrive, they can walk right in. You don't have to stop the heart twice just to open up a door. Then you're going to grab your phone. Now, they ask a lot of questions. With COVID, just add 7 more questions. So try to think facts. I know it's not easy. You want to be able to get across what happened, what'd you do for the baby, what's your baby look like now, where are you located? So we know about being home, but we're not always home. So say you're in the park, maybe the zoo. Zoo where? Where in the park? So you have to be able to say by the slides or by this exhibit. And that's 911's biggest complaint to all of us in the public is they show up, but they can't find us. Another good tip is, because I know all you parents are in the park all the time, if there are other people around, try to be a delegator. Maybe one person can watch all the kids, send another person to one end of the park, another to the other end, and this way they could try to look for the ambulance. So now, then they'll ask you the age of the child and who are you in relation. Once they have this information, they're on their way. What are you going to do? Come right back. 30 pumps, head back, puff, puff. Keep going, keep going, keep going. So when would you stop doing this? There are 4 reasons. The first one, the best one, your baby wakes up. Baby wakes up at any time, just stop what you're doing and make sure you've opened the door and you made your phone call. Second one is somebody came to help you. So maybe someone in your home, maybe I came up to you in the park. I know CPR. Do you need any help? If you need help, for sure, let somebody help you. Third, medical professional. So the first to come is the fire department. Second is EMS, and cops come to all emergency where there's a child. So 1 minute you were alone, and then you got a lot of people around to help you. And the fourth one is if you physically or mentally are unable to do it, then you just can't do it. But those should be the only 4 reasons you would stop. Now, where some things go haywire, so one is you're doing your compressions and you realize you forgot to count. You know that's going to happen. That's okay. Just add 10 extra for wherever you think your 30 would be. Same thing with your cycles. It's better to add an extra cycle or 2. Don't shortchange the baby that just to get to the phone. Some things that you shouldn't do. Call the doorman if you're in a doorman building in Manhattan or in Brooklyn area. And that's because, it's like the game of phone. That's not going to end well. Banging on your neighbor's door. Bang, 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 bang. Well, they're not even home. A lot of wasted time. It's all about speed. The other one is maybe screaming out your door. Somebody help, help, help. So somebody opens their door. Now you have to have conversation. Not everybody hops too. Some people get frozen with fear. It takes much longer. So the best thing is to stay put, do the best that you can, and something is always better than nothing at all. Questions on that?
Let me see if there are any questions that came through. That was really a tremendous assessment. Is there a way of knowing if you are deep enough? Should you feel anything break?
Sometimes people do say that they can hear a rib fracture, and I can imagine that'd be very frightening to parents or anybody caring for a little baby. But even if that happened, people have fractured ribs all the time. They fall, sports, ribs will heal. You don't even do anything for that. You should not stop if you hear that. But otherwise, no, you're not going to know that you're doing it that deep. But that's why I say you have to really press hard. You have to feel your arms pushing down. And remember, you're going to be on your knees, and your baby's going to be on the floor, not like this on a box.
Mm-hmm.
And, you know, you should really feel the oomph that your arms are pressing.
Got it. Yeah.
It shouldn't be very easy.
I think there aren't many other questions. So if we wanted to go on to maybe it's a little off topic, but everyone here I'm sure would be interested in what happens if it's a choking episode or a
Yeah.
yeah.
Mm-hmm.
But if there are any other questions, feel free to chime in at any point. But that's tremendous. Thanks, Pam. Yep.
And the one thing I do want to mention is about water, you know, especially with newborns, you know, be careful, never, ever, ever leave them alone in a bathtub. If you hire a nanny, childcare, yeah, you might say they have 20 years experience, they know, but make sure you have the conversation because drowning is very high in this country. It only takes 30 seconds for a child to drown, and they can drown in 1.5 inches of any kind of liquid. So that's your toilet, that's a bucket, pool, and so on. So you have to be very diligent. And really, the number one reason why kids drown is from these cell phones.
Exactly.
So all about distraction. So nothing else could be that important. You have to take your baby out all dripping wet. They'll be fine, okay? So anyway, so now with choking. If you can cough, talk, cry, or babble, you're not choking. Mm-hmm. So my baby's in a high chair eating her apple, and I hear like a wheezing sound. It almost sounds like my baby has asthma, but my child doesn't have asthma. I look at my baby, and I see she's turning blue. So that's called a partial obstruction. That means half your airway is open, and the other half is blocked with the apple. So that's not good. We have to get that out. So you would do the Heimlich. Second one is a full obstruction. That's when you look at your baby and you see they're purple. They can get purple very quickly. It's like bat of an eye twice or click, click, and that's it. And they make no sound whatsoever. A lot of times they're flailing their arms. That's just a sign of fear or kicking. So what are you going to do? You're going to scoop up your baby and you're going to find a place to sit. So obviously anywhere in your home, a couch is actually better than a regular straight chair because you have a little more leverage. But maybe you're out and about. So off a curb in the street, bottom of a slide, park bench, but you're watching a softball game, there's no place to sit. You have to go off of one knee or two knees. You couldn't, like, say, stretch out on the ground because you do need to have some height. Mm-hmm. And then what you know, I'm going to explain it, but it will be hard to do, unfortunately, where the camera is today. But you're going to put your baby on your non-dominant leg, almost like you're doing bouncing, okay, on your knee. Then you're going to take your non-dominant arm, so for me left, under my baby's left, and then I'm going to hold their jaw. And this basically just protects the baby's head by holding the jaw. And then it's all about flipping your baby over so that they're 45 degrees. So you see this would be straight, and this would be 45. You have to have that angle because otherwise the baby is not going to, it's all about gravity. And then right in between the shoulder blades, those two bones right here, you take the heel of your hand and you're going to give 5 back blows. 1, 2, 3, 4, 5. Got to be pretty firm and not fast. That's one of the errors people do. They do more like burping. That's not going to work. So hopefully it came out, but it didn't on this baby. So now you're going to cradle the back of the head. You're just going to roll your baby over so that your baby's looking up at the sky, but always on that angle again. And then you're going to put your 2 fingers, same spot you did for CPR, except this time if you want to turn them this way, it's easier. And then you're going to compress 5 times, but slower than you did for CPR. So it's 1, 2, 3, 4, 5. That's the baby Heimlich, causing positive pressure to push your apple up. It's not going to pop the apple out because we're upside down. So now you're going to turn your baby over. So 45 angle, okay? And then again, 1, 2, 3, 4, 5. Now, hopefully it came out and we have a crying baby. If not, you would repeat, 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 repeat. And I would say about 5 to 8 times. And then if it doesn't come out, call 911. Heimlich is extremely effective. It usually does work. So you're more likely to get this out. Now, if it comes out it's like a piece of paper, and it comes out right away, there's really nothing to do. You're going to be very anxious and nervous about feeding your baby, but it takes time to get that confidence back again. If you had to do it in...
Oh, quick question, Pam.
Yes.
When you're doing the Heimlich with the baby on forward, is the depth the same as it would be for compressions?
Yes.
Yeah, okay.
And if you can't, a lot of people can't get it that deep in the positioning that we're in. So if you can't, that's okay. We always say just do it as deep as you can.
Deep as you can. Okay.
And then the other thing is if you have to do this for an extended period of time, then definitely call your pediatrician. I mean, obviously you got it out, but always call your doctor. If it was something sharp, jaggedy, pointy, you're going to also give them a call. Maybe they'll want to look at the baby's throat or give you some instructions. And then the other one is maybe your baby swallowed a toy, and now all of a sudden the baby's crying. But where's the toy? So the toy got released from here, but it went down. Always call your doctor, and then they'll guide you as far as what to do, right? A lot of times now they want to do films, depending on what they swallowed and the material, and so on. Be very careful of button batteries. They're extremely dangerous. They find them in adding machines, kids' toys, cameras. If you have an elderly grandparent around, they might have hearing aid, or anybody with a hearing aid. Now, what happens if the apple doesn't come out? The baby can go unconscious. If the baby should go unconscious, then you're going to lower them to the ground. And what do you think you do? CPR.
CPR, yeah.
So you do your CPR with just one extra motion. So you do your compressions 30 times, head back, but then you're going to open up the mouth and you're going to look inside. If you see the object right here, you can pluck it out. So pluck means thumb and index finger, pluck. What did I not tell you to do, which a lot of you watching this may have had CPR in the past. You remember that scoop that we used to do. So we no longer do that. And that's because 7 out of 10 cases, you can embed the object further down. So we don't want you to scoop and dig out that food or toy, but you always want to just pluck it out. But if it's too far back, you can't sweep it, and you don't want to breathe because you'd push it further down with your breath. So skip the B altogether, come back to your letter C, and hopefully that's causing pressure to push it up where now you can take that out. But not everything we see. So if you don't see anything, always give 2 breaths. So just to go over that, if the baby should go unconscious with Heimlich, with choking, lower them to the ground, and if you see the object, you pluck it out, that's fine. But if you don't see anything, always give 2 breaths. And then remember things like grapes, hot dog, popcorn.
Yeah, we always say anything that's round or has an intact skin is a good way to think about it. You want to cut those down.
Yes.
So if the baby goes unconscious and you see it, you put it down, you don't do compression. You first thing you try to do is pluck it out?
No, if they're unconscious, immediately go right to your compressions.
But then when you do the airways, if you see something, then you pluck it out.
Right.
If you don't see something, then you still do the whole cycle.
Correct. The only thing is we just don't want to breathe if it's back there and you could pluck it out.
Got it.
But if you don't see anything, what they do is want you to breathe, because like here's the Lego, like over on the neck. We want the oxygen to go around the Lego to the brain. And that's how we also want you to try to give breath to the baby, even though you're not going to know whether it's working or not.
That's great. That's super advice. All right, should I go to the questions now, or?
Sure.
Okay. First, this is great. Can my husband watch a replay? We'll put this on the Premier Pediatrics New York Instagram TV. And you could always reach out to Pam directly at Savitot. She'll give you the address again at the end. And she has all sorts of courses, which I can't recommend enough. Should you stop compressions if the baby gasps or wakes up?
Very good question. It's more common with adults, not so much with little ones. But let me explain it to you this way. What would happen if you found your baby blue? So first of all, blue, we know right away, lack of oxygen. So that's not good. Now I try to wake up my baby, and they're kind of moving a little bit, but this is how my little one wakes up in the morning? No. And then are they breathing? So if you feel any kind of breath, let's say if I'm looking for breathing, I don't feel anything. Oh my God. Oh, I feel a breath. But now I don't. Now I do. Would you do CPR? Actually, now you would. And what they're saying is they want you to look at the whole picture. And the whole picture is if you don't kind of start now, you are going to have to start soon. And another one that goes with that is with the question that was gasping, trying to get air and can't getting any air. I would still continue it. Most of the time, little kids are going to tell you, you don't need to do this anymore. Because just think of your own self, somebody pushing on your chest 1.5 inches and then blowing into your lungs. If you don't need that, they kind of push you away. They kind of move all around when you're doing that. So they're going to send you that message. And the statement also goes, it's better to do than not to do. So if you're ever in a situation and you're unsure, if you have to say, do I need to do CPR? Most of the time, the answer is going to be yes.
That's great advice.
Than not do.
Yeah, especially with time being so the urgency of time, it's better to make that decision to do it. All right, another question was, can you repeat what you need after the first sequence? Check for response, right?
Yes, so you're going to be checking for 3 things: color, movement, and breathing. So color is going to be, does my baby look the same, worse, better? And if you don't know, it's okay. Any kind of movement, but that's movement from the waist up. So kicking does not count as movement for babies under a year. After a year, that's okay. And then is the baby breathing?
And then you do that after 5 cycles, right?
Yes.
After 5 cycles,
just
right.
After the first 5 cycles, then you wouldn't keep checking that. Just keep going. So just for argument's sake, let's say they don't come to you, the ambulance, for 10 minutes and your baby is the same. You would do this for the 10 minutes. So a lot of people ask, like, oh, I've done this for 5 minutes. It's not working. What do we do now? There's no next step. There's only one step and you just keep going.
Wait, so I'm a little confused. So it's after 5 cycles you check, but then after that, you just keep going. You don't check again, really, it sounds like.
Correct. You don't check again. Yeah. Just keep going.
Yeah. Now, someone asked, is there a video anywhere that you would recommend in particular to kind of drive home these points?
You can look, it's just to be, first of all, with a video. Yes, of course, YouTube, you can find lots of things. I would look for something from American Heart Association. You can always reach out to me. The one thing I will say, be very careful about, there is more videos and false information out there. That's stuff that looks perfect. I've watched them myself, and they're from 20 years ago or from a different country. Not all countries do this the same. So that in America, in the United States, there's a lot of stuff from Australia, and a lot of their techniques are very different than the U.S. So you do want to make sure that you're watching current information.
Got it. When you, Pam, helped our office with our CPR, and there were those virtual cases where you could actually do the cases. Is there something that you could point people to with that?
Yes. You mean like with the doll and like that kind of thing, like a kit?
No, there were actually cases online that, again, you had given it to us where they told you about a baby, and then you would go through the motions as though it were happening in real time.
That's a whole different thing, and that would be to take. Yeah, it's part A and a part B, and the one you're talking about is a part A, and then you would still have to go within an educator, do this, and all that technique, and you would get your certification card. But that's like different. You couldn't do that. But I do give classes virtually if anybody's interested. And COVID now, most of us are doing it online. And believe it or not, I didn't think it would work. But you bring a teddy bear, you bring a doll or a pillow if you don't have anything. And we can do it just like this, and working out really well.
Excellent. And then someone asks, it's probably worth reiterating, is what do you do for a partial obstruction?
Partial obstruction, you would do the same as a full obstruction, and that's your 5 back blows. 1, 2, 3, 4, 5. Roll the baby over. 1, 2, 3, 4, 5. Roll the baby over. So just to go over is that when you're choking, once, I call it a cycle, it's not written as such, but one cycle would be 5 back blows, because that maybe popped the apple out right away, or it loosened it up. When you roll the baby over and you do those compressions, which is basically the Heimlich, that causes positive pressure to push up your apple. But then you're going to have to roll the baby over now to pop it out.
Mm-hmm.
So it's kind of like those 3 components make up that one cycle.
That makes sense. A good way to think about it. Well, that's great. Now, just someone had asked a question earlier, but I don't think it's related to CPR. So if Jack KP543, if you'd like, I'm happy to answer that question. Just give me a call in the office or reach out to me and I'll help you with that. And then, yeah, Pam, I thank you for your time. That was a tremendous.
You're welcome. It's my pleasure.
Session. Anytime. Yeah. I mean, well, again, we'll have this on our Instagram TV if you want to watch it, or you have friends with young kids who might want to watch it. And that concludes the Instagram kind of component of our sleep series. And we covered how to teach kids how to sleep, how to work on sleep training, not sleep training, but coaching your kids to be good sleepers. We had a session on the sleep routine, and now this one on CPR. Oh, I'm sorry, go ahead.
No, I was saying it was excellent. I watched the sleep ones. Really good information.
Yeah, thank you so much. And then if anybody wanted to take part in our small group Zoom sessions, where we'll go over individual cases of patients in our practice with a sleep expert, which should be wonderful, just feel free to reach out to me at the manager at thefirstmonth.org, and we'll get you set up for that. But Pam, as always, it's great to see your face. You're an old friend to the practice, and we always appreciate you. And stay safe and stay well.
Yeah. You too. Bye-bye. Stay safe, everybody.
Bye, Pam.
Bye-bye.